Hi, Dr. Buru here. I'm with my good friend George. George is agreed to be a model for examination. I work at the University of Nairobi. I teach medical students, which is one of my favorite activities. So, George, I want to examine your hands. Okay? Now, the traditional way of doing it is look, feel, move. And I always tell the students, look here, if you're stuck, you cannot go wrong with look, feel, move. However, I think that the most important thing is to have a systematic way so that you do not forget various things. And sometimes your examination will vary depending on what you need to examine for. For example, if somebody is an old person with radial sided wrist pain, it's probably arthritis. So you don't have to do all the examinations. You cannot like restrict yourself to what you think is the main pathology. So today I will examine the hands, okay? And very important in hand examination is inspection. So the first thing, George, I'll get you to do is to do this. Excellent. So you want to take time to inspect. And you want to check for any swellings. You want to check for symmetry. You want to check for any redness or color changes. You want to check for any atrophy of any of the muscles. So for example, if you've got median nerve problems, you're going to get atrophy of the thenar eminence. If you've got ulnar nerve issues, you're going to get atrophy of the hypothenar eminence. And can I get you to turn back? You're going to get atrophy of the interosseous muscles, okay, including the first dorsal interosseous. Can I get you to do this? So that's very, very important. Then you want to check for deformity, depending on what the patient has. Sometimes the patient has had a previous injury, and therefore you want to see, do they have deformity. One way of checking for deformity, especially if they had a previous fracture, is to check for rotational deformity. So what I will do is I'll tell George, can I get you to do this? All the way. Okay, not completely actually, a bit. If you, just open your fist a bit. Open it just a little bit. So one of the things you will find is that his fingers point to the scaphoid. Okay? But if he had a rotational issue, you would find that one, it could be like that. So then you know that there is a rotational issue. That's a good way of even screening, and a patient has got a fracture of the phalanges or metacarpals to see whether or not they'll need surgery, or they will need a bit more careful management if they have a rotational deformity. Okay, so so you check this way and you check that way. All right. Now, can I get you to do this? And also, don't forget, you want to check the nails. Is there anything in the nails that may be pointing towards any specific pathology? Okay, I'll get you to do this. You sometimes can do just a screening examination of the movements just to see how much they move, if there is a problem at all. Okay, that's fine. Now, the next thing that you want to do is you want to palpate. And it depends on the pathology. So there are various places you can palpate. Okay, let's start with this side. So you can palpate the region of the wrist. And in the region of the wrist, you want to palpate the, could I get you to do that? You want to palpate the first dorsal compartment, the second dorsal compartment, the third dorsal compartment, the rhesus tubercle, which is there, the extensors this way, the fourth, the fifth, and the sixth dorsal compartment. All right, you also want to palpate for the tendons here. Flexor carpi radialis, the palmaris longus, and the flexor carpi ulnaris. Then you want to palpate the wrist, generally looking at the patient, or it's fine. You want to palpate along the metacarpals to ensure everything is fine, along the phalanges to ensure that everything is okay. All right, now after palpation, you want to evaluate the hand with regards to a neurological examination. So what are the things that you look for? Well, one of the things that you can look for is, we had seen on inspection, you check for atrophy. And if there's atrophy, especially of specific muscles, it will indicate to you that there could be a nerve problem. But The other thing you could also do is check for sensory. Now, how do you check for sensory? First, I will go and check for sensory of the radial nerve. So I'll tell you to do this. Excellent. So the radial nerve, the isolated region of radial nerve sensation is that. All right, so that area. So I ask the patient, are you able to feel me there? Are you able to feel me there? And if the patient can feel, then I know the radial nerve is fine. Now, because I may forget or I want to be done with the radial nerve, I will get you to do that. Excellent. Put your wrist like that. And I want to push against you and push against me. Excellent. So I know the radial nerve is fine. There is no wrist drop. And I go the other way. Excellent. That's good. So the other nerves is the median nerve and the ulnar nerve. So with the median nerve, I'll ask the patient whether they can feel me touching there and whether they can feel me touching there, and to see if they're equal. If they're both equal, then I know that the median nerve is okay. And then I can ask the patient to do the OK sign, which is really the anterior interosseous branch of the median nerve, and I'll pull against them and I'll stop, tell them to stop, and it's fine. So we can see the median nerve is fine. With regards to the ulnar nerve, I'll tell them to do this, and I'll tell them, can you feel me touching you there? Can you feel me touching you there? And if that is okay, then I know that the ulnar nerve is fine. All right? But I can also tell them to do this, I guess like this, and stop me from pushing your fingers. So stop me from pushing the fingers. So a deduction and a abduction, if that is okay, then I know that the ulnar nerve is fine. I can proceed to do what is known as an Allen test to check for circulation. So one of the things that you do is you feel the pulse. The radial pulse is just radial to the flexor carpi radialis, okay? And sometimes what we can do is we can tell, you can do the modified Allen test. So I want you to do this and that and that. And spread your fingers. And you can see that he's got good circulation. So it means his ulnar is working well. The other Allen test you can do is, can I get you to do the same, make a fist and open? Okay, so you can see that it's losing its, okay, open. But when I do this, you get the vascularity back, okay? So his circulation, his collaterals are working quite well. Then you can check for movements. Now specifically, you want to sometimes check for movements of specific tendons, okay? You can do a screening exam just to see how it is, but then you can check for movements of specific tendons. You can check for movements of the flexor digitorum profundus. So with the flexor digitorum profundus, I will put my fingers there and I'll tell you flex this, good. And you see, I'm isolating and the flexor digitorum profundus is working for that finger. If I want to check for the other fingers, I do the same, okay? What about the flexor digitorum superficialis? Well, with the flexor digitorum superficialis, I have to isolate the other fingers. And then can I get you to flex that? And that works, okay? If I want to check it for this, I check that and I isolate and that works. So flexor. Now, the other thing that I could do is I could check for the flexor pollicis longus. And with regards to flexor pollicis longus, I will tell you to flex that finger and I can see that the flexor pollicis longus is working. With regards to the extensors, can I get you to do this? Can I get you to do that? And you can see that the extensors are working too. So with regards to the extensor pollicis longus, the extensor pollicis longus is this tendon here in the third dorsal compartment. So I will do retroposition. Can I get you to do this? And just put it up. And the extensor pollicis longus is working. Sometimes you may want to check an individual. You may want to check an individual muscle. For example, the flexor pollicis brevis, okay? And this is one of the tendons or muscles that are affected when you've got carpal tunnel syndrome. So what I will do, I will tell you to do that, good. And then I'll tell you to push against my hand, push against my hand. And then I feel that, and I feel that it's fine, so that the nerve supply to flexor pollicis brevis is working. All right. So that, in a nutshell, is the examination of the hand. Depending on the pathology, you may need to do some other tests, which I will demonstrate individually. Thank you very much.